This week we're going to talk about over-the-counter and performance-enhancing drugs. So some definitions you should be aware of. So generic versus brand name. Brand name is the name of the original drug. So when a company creates a new drug, they have a brand name for it, or they have a patent on that drug for usually about 20 years, where nobody else can manufacture the same drug until the 20 years is up. And the generic name generic brand can then be made, and the consumers can then have a choice between the brand name, which usually costs more, and the generic brand. Bioequivalence is when two drugs, so a generic and a brand name, have the identical physiological and pharmacological effects. So they affect the body exactly the same, but they are manufactured by different companies. But then bioavailability comes into play, and it's the extent the drug enters the circulation or reaches the site of action for that drug. So depending on what each company has also added into the drug, that changes how the drug is absorbed into the system, or it works on the system. It can change. It's more the inactive compounds in the drug that can change how the drug is absorbed. So misuse of over-the-counters. So there's generally three reasons why somebody would come to the Emerge for a misuse of over-the-counter. So the first one is likely it's related to more so illegal drugs than the misuse of over-the-counters, so much more cocaine, heroin, those types of things. Second is prescription drugs are often used for suicide attempts, unfortunately. They're usually mixing antidepressants, anti-anxiety, and pain-relieving drugs are generally the reasons why somebody would come to the Emerge with a suicide attempt. And then combining prescription with other drugs, so mixing meds and pain relievers with alcohol can be serious effects on the body. So there are generally 4 classes of analgesics, so pain-relieving medications. The first is aspirin. Aspirin's been around for a very, very long time. It's also known as acetylsalicylic acid, or ASA. It's used for analgesic, which is pain relief, anti-inflammatory, and antipyretic, which is really just lowering the body temperature, so somebody who has a fever. Many side effects in this one. It can be very dangerous to give this type of medication for children, and they can die from having too much. Acetaminophen is the generic name of Tylenol, which is the brand name. It's used for its analgesic, pain relieving, and antipyretic, which is the lowering body temperature like a fever, but it's not an anti-inflammatory. Again, lots of side effects as well for this medication. Ibuprofen is the generic name of Advil, Midol, and Motrin. Fewer side effects, but it's also used for many things as well. Naproxen is the newest. The brand name would be Aleve. It can have some irritation, but less so than the older types. So 1 in 4 drug-related Emerge visits for attempted suicide in 2008 were related to taking some of those kind of medications, but they were also combined usually with alcohol when somebody would come to the Emerge. So some other over-the-counter, so some sleep aids, so Benadryl and Unisom and things like Tylenol PM are all sleep aids, and these should never be combined with other depressants. So when we talk about depressants, we're talking about things like alcohol or other benzodiazepines, so things that would slow the respiratory system. These also slow the respiratory system, and instead of just going to sleep, you might go into a coma, or worse, your entire respiratory system would fail and you would stop breathing. So cough and cold remedies, so there's some problems with it. So they would produce drowsiness in adults, so if you take your NyQuil before going to bed to stop your cough, you're probably going to get drowsy and go to sleep. But with children, something called a paradoxical effect can happen, where it actually can stimulate the child, so it actually would make them more awake and more active. And a lot of these medications contain a type of alcohol, so if you're also drinking alcohol on top of taking a cough and cold, it's way extra. You feel way more intoxicated because it's actually doubling the effect. Things like pseudoephedrine and DM or DMX. These are all high-risk medications that are in some cough and cold remedies, and they usually are behind the pharmacy desk now because of their effects and people abusing them. So you actually have to ask the pharmacist for them. You just can't buy them off the shelf. So now into more anabolic steroids. So this is the performance enhancing drugs. So ergogenic is just the definition is performance enhancing, while androgenic promotes the masculinizing changes in the body, so just more muscle, more masculine looking, while anabolic is an upward changing, so it's increasing muscles. So therefore they're called anabolic androgenic steroids, and these are different than the adrenocortical steroids, which are more a medication, and usually they're actually weakening the muscles instead of increasing them. So some hazards. So when a male is taking the anabolic steroids, smaller testicles, the actual because there's so much extra testosterone in the system from taking the steroids that the testes don't think they're needed anymore and they simply shrink. Gynecomastia, so it's actually male breast enlargement because the steroids are breaking down into estradiol, which is a female sex hormone, which it feels like it's creating more estrogen in the body, which creates breasts. Severe acne, facial hair, accelerated balding, so losing hair. In women, lower voice, facial hair, decreased scalp hair, which these can all be reversed if the woman does stop taking the steroids. So steroids in other system, it can affect your liver by creating liver tumors, high blood pressure and high cholesterol, and heart abnormalities. So some psychological problems that come along with steroid use. They've called it roid rage, so steroid rage, meaning aggression. This is variable. It's not definite when somebody takes steroids. On average, testosterone is increasing manic and aggressive behavior, but some don't have mood changes at all, or they become more euphoric, or they have a decreased need for sleep. And studies have shown that there has been no actual violent events because of using steroids. So adolescence and steroid use. So boys, when they're using steroids, is actually suppressing the long bones in the body from growing, so like mostly the legs and the arms. Girls, testosterone would delay puberty and would create shorter and lighter bodies while enhancing strength. So some psychological effects, so euphoria and aggression, and when they stop steroids, they're kind of feeling lethargic, a loss of confidence, and depression. So some dependence issues, so different slangs that are used for somebody who might be using steroids. So stacking is combining different pills and injectables simultaneously, so they're taking 2 different kinds of steroids or more at the same time. Shotgunning would be just taking whatever's available to them, so they're not even necessarily the same types of steroids. Cycling, steroids are taken for a time and then off for a time, but then absence from steroids, if you stop it all of a sudden, can cause depression, sleep problems, lack of appetite, moody, and panic that their body is shrinking, because it will shrink when you stop taking steroids. Pyramiding, so what somebody would do is they would start at a very low dose and gradually increase before some type of competition, and then taper off just before the competition to hope that if there's a drug test, then it wouldn't be detected. Other problems could be muscle dysphoria, which is kind of similar to a reverse anorexia. So they would look in the mirror and see their body as weak and small, while somebody who is anorexia would see themselves as fat and the opposite. So some dependence issues with this. So it is higher than reported. So people say they're not dependent on a steroid, but they potentially could be. They seem to be taking them for longer than they intended, so larger doses, and they're experiencing physical or emotional problems when they stop, so they're having a withdrawal. So some non-steroid supplements that could cause the same kind of effects. Human growth hormone can actually cause a misshapen head, enlarged limbs, and damage to organs. Um, these kind of medications could be given to children who have stunted growth, so it's actually going to help them grow. It is a pituitary hormone, a pituitary gland in the brain. This is the hormone that it produces. Increases lean body mass, but not strength and endurance. Some dietary supplements, vitamins and minerals to build muscle or improve cardiovascular performance. So there are other other supplements that are out there. This is a chart that talks about how long various drugs are held in the urine. So if you have a urine tox screen, this would be how long it would stay in your urine from the time you take it until they do the urine test. And this is my source where I found the information for this PowerPoint.